There are several lines of defense against germs in the body. One of those is adenoids and tonsils. In tonight's edition of Feel Great Today, we'll explain how they protect your body from infections.
Feel Great Today with Jessica Jukic.
Adenoids and tonsils are part of the lymphoreticular system, which is the part of your body that helps your immune system fight infection.
Dr. Greg White is an ear, nose, and throat doctor at Aspirus Rhinelander. Adenoids and tonsils work together to identify, trap, and fight bacteria and viruses.
We have a lot of fluids that circulate through our body, and it samples that for signs of things that shouldn't be there, and it sends out signals to recruit other cells and sends out other chemicals to help fight infections that it detects.
Sometimes tonsils and adenoids can become infected, causing a variety of symptoms.
Adenoids will cause nasal congestion and drainage, and sometimes mucus collecting in the back of the throat. Tonsils will cause a really bad sore throat, some difficulty swallowing, pain when you swallow, sometimes obstruction of your throat.
Dr. White says he will remove tonsils and adenoids if they become permanently inflamed or if you have an abscess or several infections a year for several years.
3 infections a year for 3 years, 5 infections a year for 2 years in a row, or 7 infections in 1 year. If people are really allergic to a lot of different classes of antibiotics and it's more difficult to treat an infection, we might be more apt to take the tonsils out then.
He says tonsil and adenoid problems are more common in children and teens than in adults. Enlarged tonsils can also cause issues when eating or sleeping.
In kids, taking out tonsils and adenoids for snoring and disruptive or disordered sleep is successful about 85% of the time. So it's kind of one of the first line things you do for children.